Hi, I'm Nurse Carol. After 30 years caring for women just like you, I want to share something I wish every woman over 50 knew. So pour yourself a cup of tea, get comfortable, and let's talk, just the two of us. Let me ask you something gently, just between us. Have you ever looked in the mirror and seen a belly that simply will not flatten, no matter how carefully you eat, no matter how faithfully you exercise? Or noticed a strange little ridge running down the middle of your tummy when you try to sit up in the morning? If that sounds familiar, I'd like you to stay with me for a little while, because that belly may not be what you think it is. It may not be fat at all. And there's a gentle explanation, one that far too few women are ever told, and one that can lift a great weight of self-blame off your shoulders. Stay with me right to the end, because there's one popular exercise that so many women do to flatten their tummy that can quietly be making this worse. There are small, everyday habits that either help you or hurt you without your knowing. And I'll show you a gentle exercise, one you can do anywhere, that many women find truly helps. Let me paint a picture for you. Down the middle of your belly, you have two long bands of muscle running side by side from your ribs down to below your navel. But the important part isn't the muscles themselves, it's what sits between them. Right down the center, joining the two sides, there's a thin band of connective tissue. Think of it as an anchor line, holding those two muscles gently together. When it's firm and springy, your belly is flat and steady, but when it stretches and weakens, the two muscles begin to drift apart, and a little gap opens up down the middle. Doctors call this diastasis recti, abdominal separation. Now let me tell you why it happens, and why for some women it simply doesn't bounce back. During pregnancy, especially in those final months, the baby grows, the belly stretches, and that band down the middle is pulled taut, a little more each day over many months. If your connective tissue is strong and elastic, then after the birth, as the belly softens, it slowly draws back in and coaxes the muscles home. But if that tissue was on the looser, weaker side to begin with, it can't quite spring back, and so the gap stays. That's not a failing on your part, it's simply the nature of the tissue you were born with. And here's what surprises people. It isn't only women who've had babies. Yes, pregnancy is the most common cause, but it also happens to women years, even decades after childbirth, to women who never had children at all, even to men and to younger people too. So if you've quietly been blaming yourself for your belly all these years, please stop. This isn't laziness. It isn't a lack of willpower. It's the connective tissue, and that is not your fault. Now let me tell you about someone. Years ago, I cared for a woman. I'll call her Dorothy, a warm, capable lady in her late 50s. She told me with tears in her eyes that for nearly 20 years, her family had teased her about her rounded belly. She'd eaten carefully, she'd exercised, she'd tried every remedy going, and nothing changed, which only made her feel worse about herself. When we looked properly, there it was, a separation right down the middle. And the relief on her face when she understood it wasn't her fault, I'll never forget it. Now, I would never promise you that any exercise erases a gap completely. That isn't how it works, and results vary from woman to woman. But Dorothy worked patiently with her doctor, and gently, over time, she grew stronger and felt far more comfortable in her own body. What helped her most, I think, was simply being told the truth, kindly, after all those years. Now, would you like to check gently right where you are? Lie back comfortably with your knees bent and your feet flat on the bed. Take a breath, and as you breathe out, lift your head just a little, only for a moment, and look down at your belly. Do you see a ridge or a soft little valley running down the center? Here's another way. With your fingers, press softly just above your belly button. If you feel a gap, a soft space your fingers sink into 1, 2, or more finger widths wide, that's a sign of some separation. A small gap, less than about 2 finger widths, is common and usually nothing to worry about. Wider than that is worth paying gentle attention to. And do check just below the navel too, because sometimes the gap sits there instead. Now, the popular exercise I promised you. If you do have a separation, this is the moment to be careful with sit-ups, crunches, and full planks. I know, those are the very exercises everyone swears by for a flat tummy. But for a belly with a separation, they can do the very opposite. Here's why, in simple terms. When you curl up hard, the pressure inside your belly rises sharply, and instead of drawing those two muscles together, it can push them further apart. Some women even notice the middle of the belly rise up into a little ridge or dome during these moves. And that doming is your signal to stop. So many women crunch away for months, quietly puzzled that their belly only seems to grow rounder. It isn't your fault. And it isn't a bad exercise. It's simply the wrong one for this particular thing. If you're unsure, a physical therapist can check you and guide you safely, and that's a wonderful place to start. And it isn't only exercise. There are small, everyday moments that quietly put that same pressure on your middle, and once you know them, they're easy to soften. When you get out of bed in the morning, don't sit straight up like a crunch. Instead, roll gently onto your side first and push up from there with your arm. When you lift something, a grandchild, a bag of shopping, breathe out gently as you lift, rather than holding your breath and bearing down. And here's a lovely little trick. When you feel a cough or a sneeze coming, gently draw your belly in and support your middle. These are tiny changes, but done all day, every day, they take a great deal of strain off that healing tissue. Now, you may be wondering about surgery. Let me be balanced and honest with you. For some women, with a very large separation, surgery is the right choice, and that is a decision to make together with your doctor. But for many others, gentle exercise and a little patience can make a real difference over time. So if surgery is ever suggested, it is perfectly reasonable to ask your doctor about all of your options, including the gentler ones, and to take your time deciding. A good doctor will welcome those questions and will want you to feel sure. So let me show you the gentle exercise. It has a technical name, but I simply call it the deep belly draw-in. And the idea is beautifully simple. To coax those two muscles back toward the middle, you gently draw your belly in. You can do it anywhere. Lying down, sitting, standing, even walking. First, breathe normally once or twice to let your body relax. Then breathe all the way out, and as you do, gently draw your navel in toward your spine, as if you're softly hugging your middle from the inside. Not a hard, straining squeeze. Gentle. Hold it there. Keep breathing softly, and with each breath out, draw in just a touch more. Hold for as long as it's comfortable, perhaps 10 or 15 seconds at first. Then slowly let go. Let me share the little mistakes I see most often so yours goes well. Don't hold your breath. Keep breathing softly the whole time. The breath and the draw-in work together. Don't suck up high under your ribs, puffing your chest. The feeling you want is low and deep, below the navel. And don't force it to the point of straining or trembling all over. Gentle and steady wins here, not fierce. That deep, quiet tightening low in your belly, that's exactly the feeling you're after. Not the strain of a sit-up, something softer coming from within. And here's something lovely to understand. Those deep muscles don't work alone. They work as a team, with the big breathing muscle above, your diaphragm, and with the floor of muscles at the very base of your pelvis, your pelvic floor. Picture them as the top, sides, and bottom of a gentle canister. When you breathe out and draw in, you can also give a soft, gentle lift to that pelvic floor. the muscles you'd use to stop yourself passing water. And the whole team works together. This matters especially for us after 50 because those pelvic floor muscles support so much. If you ever feel a heaviness or a dragging sensation low in your pelvis, do mention it to your doctor. It's common, it's nothing to be embarrassed about, and there's gentle help for it. Done gently, just a little each day, many women find the draw-in helps strengthen those deep muscles over time. Now, results do vary from woman to woman, and if your gap is wide, please check with your doctor or a physical therapist first. But it's such a kind, simple habit. You can fold it into brushing your teeth, sitting at dinner, standing at the sink, or watching your evening programs, and no one will ever know you're doing it. Now, I want to widen the picture for a moment, gently. That band down your belly is connective tissue, and connective tissue isn't only in your belly. It's woven all through you, in the walls of your veins, in your joints, in your skin. So some women, as the years go by, notice a few things arriving around the same time. Perhaps veins on the legs, or achy joints, or skin that's lost a little of its spring. I'm not telling you these are all one certain thing because bodies are far more complicated than that. But it can be worth mentioning the whole picture to your doctor, rather than treating each little thing as a stranger to the others. Caring for the tissue that builds all of it, through good nourishment, is kind to your whole body, not just your middle. Which brings me to something close to my heart. Our bodies build and repair this tissue from the food we eat, so nourishment truly matters. Protein is the foundation, and many women, especially after 50, simply don't get enough of it, spread through the day. Vitamin D plays a quiet role too, and a great many women run low on it without ever knowing. That's well worth asking your doctor to check with a simple blood test. Collagen-rich foods, a good homemade bone broth, for instance, along with plenty of protein and plenty of water, give your body the raw materials it needs. Now, no food closes a gap on its own, but well-nourished tissue repairs far, far better than tissue that's going without. And a gentle word for those of us past 40 or 50. After 40, our bodies make collagen a little more slowly, and collagen is the very stuff this tissue is built from. That doesn't mean improvement isn't possible. It absolutely is. I've cared for women in their 50s and well beyond who made real, steady progress. It simply asks for a little more patience, a little more consistency, and a little more care with what we eat. Kindness to yourself, repeated daily, is its own quiet medicine. Let me answer the questions women ask me most, because you may be wondering the very same things. Nurse Carol, I had my children 20 years ago. Is it too late for me? No, it isn't. Connective tissue can be encouraged at any age. It may take a little longer, but I have truly seen it. I never had children, but I have that gap. Can I have this too? Yes, you can. Remember, pregnancy is only one of the causes. And can I do yoga or swim? Both can be lovely. Many gentle movements are wonderful, but be cautious with the ones that curl you up hard or hold a long plank, and do tell your instructor about your separation first. Swimming in particular is gentle and kind to the belly. When in doubt, a physical therapist is your best friend here. Now, I promise to be honest with you because that's what a good nurse does. Not everything can or should be handled gently at home. Please see your doctor if the gap is very wide and hasn't improved after a couple of months of doing the exercise properly. Or if you feel a lump or a bulge in the middle of your belly, especially when you cough or strain, because that can be a hernia and it truly needs a doctor's eye. Or if you have ongoing pain or back pain that simply won't settle. Those are the times to be seen and to go in with your questions gently ready. Let me gather all of this into something easy to hold on to. That stubborn belly may be a separation, not fat, and it is not your fault. Be careful with sit-ups, crunches, and full planks if you have one. Soften the everyday moments. Roll out of bed. Breathe out as you lift. Support yourself before a cough. Surgery is right for some,
but gentle exercise helps many. So ask about all your options. Nourish your body with protein, enough vitamin D, and plenty of water. And the gentle daily draw-in, done kindly and low and slow, can make a quiet difference over time. Our bodies are always speaking to us, and that stubborn belly has been trying to tell you something all along. Now, at last, you know how to listen. Take good care of yourself. You've earned it. And remember, always check with your own doctor or a physical therapist before starting anything new or about anything that doesn't seem right. This is Nurse Carol, wishing you health and peace. I'll see you next time.